Hey friends, it's so nice to be with you again today. And today for this especially special topic, one that's near and dear to my heart, and that is birthing and birth choices and birth environments and all about birth. And before we go into that, I want to talk about nutrition for a healthy baby. Now, I've had a lot of children, and I understood as I learned more over the years in particular, I understood the importance of nutrition for a developing child as well as to protect the mother's health. And to that end, eventually I found green pasture products, cod liver oil, and now green pasture products, fermented cod liver oil and butter oil blend. The reason for this is that a developing baby requires a just a boatload of nutrients. And if the mother does not put these nutrients into her body, the child will take as much as it can from the mother's reserves. And so it is really critical that we have a nutrient dense diet to produce healthy babies, as well as to protect the mother's own physical health. Green pasture products, fermented cod liver oil, and butter oil blend is just a boatload of nutrients that are super critical for all of these purposes. It includes, of course, the fermented cod liver oil, which has fully formed true vitamin A and vitamin D in the correct ratio. The fermentation produces an explosion of nutrients, in fact. And then when combined with butter oil from cattle that are eating naturally grazing lush green pastures, in particular in the spring and in the fall, when there is another explosion of nutrients that goes into the butter fat of the cattle or the goats, but this happens to come from cattle. So with the last several of my babies, I consumed this every single day, a teaspoon or two every day, morning and night, if I could. But when I found myself pregnant with my 8th child, right on the heels of the 7th, then I especially knew I had better be very careful and load up heavy on all of those nutrient dense foods and this one supplement. I don't believe in supplements. If you've watched me for any time at all, you probably know that. But this is a food. This is food, and it is critical food for the developing baby as well as to protect the mother's health. You can use the code GGT10 for 10% off your order. There will be a link in the notes following this. So take a look, check it out. You cannot do anything better nutritionally. Of course, eat a nutrient dense diet, but to add additional nutrients that are so important, try green pasture products, fermented cod liver oil, butter oil blend. It tastes good too. So, hey, what's there not to like? Pardon me. So today I am super pumped to be introducing you to a certified professional nurse midwife, Karen Winstead. And Karen, I'm going to welcome you on right now. Hello there, Karen.
Hey, it's good to be here.
I'm so glad that you are here. Would you like to tell us a little bit first about what brought you into midwifery and this whole alternative realm of birthing?
Sure. So, when I was a nurse in a small hospital here in Franklin County, Virginia, I was on the obstetrics floor, and the ladies who came into birth showed me that there was a better way. At this small hospital, probably a third of the women had an epidural, and maybe a third of them got a shot of pain medicine, and the other third had no medication or anesthesia for their deliveries. And so they just taught me that, oh, people can labor and they can make it through labors without all of this to do. And
Yeah.
um, then I was kind of dissatisfied because it seemed like there were a lot of balls that were dropped. I think the story that really hit home with me was we had a lady who was with us for her third child, 19-year-old single mama. And this was her third baby.
Oh
And
my goodness, at 19.
19. And
Wow.
one of the night nurses sat down with her with that third baby and said, well, honey, can you tell me about the dad? You've had 3 babies with us here. and we've not seen a father. And the woman finally related the story that she had been raped by her mother's boyfriend for the last 7 years.
Oh my goodness.
And we have been seeing her, our physicians had seen her practically, 6 years of the 7 years, had been doing prenatal care and postpartum care with her. And she'd been bringing her children to pediatric appointments, and nobody felt, she didn't feel safe enough to, I guess, tell anybody what was going on.
Oh my goodness.
So that was just, kind of the straw that broke the camel's back for me, because I had seen things dropped along the way that I thought, surely we can do better.
Yeah.
And so I had been praying over the years, because when I started on the OB unit, it wasn't legal in Virginia to have out of hospital births. It wasn't legal to be a midwife, and none of our hospitals had midwives in them. And we had some underground midwives. We had a couple of those in the area. And I just started praying, because at that time I thought, as I had been taught as a nurse, that, oh, it's terrible to have a baby out of the hospital. Nobody should have a baby out of the hospital. And yet we had people having their babies out of the hospital with people who weren't doing it legally. And so I just started praying about the situation and asking God to bring some nurse midwives to the hospital, where nurse midwives should, practice. That's what I was thinking. And then after, I don't know, a couple of years, finally one day the Lord said, "Oh, you could do this." And I said, "No, I can't." And we argued about it over a period of several days, and he kept saying, "Yes, you can." And so finally I said, "Well, Lord, every time I've gone to school, I've had a partner to go with." And I said, if you'll do two things, if you'll provide me a partner to go with to midwifery school, and you will, and my husband will agree that I can do this, and that, I'm going to have to work part-time, and, I've always had a full-time job, and, I just don't know how that's going to go over. So you're going to have to, put it in his mind that it's okay, and you're going to have to bring me a partner. Well, the very next day I went to work and was assigned to orient this new nurse to OB. And it was a slow day. And so we were sitting there talking, and I was like, "Well, what brings you into, labor and delivery? Why did you want to work here?" And she said, "Oh, I'm going to midwifery school."
I was waiting for that. Isn't it? Be careful what you pray for, because when you pray in faith, things happen, don't they?
So I went home. So I told her, I said, "Well, let me talk to my husband about this," because she had said, "You want to go with me?" That was the next words. "You want to go with me?" And she was just joking. But I was like, "Okay, well, let me ask my husband about this." And so I went home and said, "Hey, what do you think about this?" And he was like, "Well, if you could make the same amount of money after you get out of the, I think we'd be okay. Once you finish the program, if you could make at least what we're making now."
Oh,
And
wow.
so I went back the next day, and I told her, "Oh yeah, I'm going to go with you to midwifery school." And then her mouth broke open.
Wow. That is so cool. So what year was that, or how long ago?
Oh gosh, I graduated in 2003, I think. So
Okay.
probably 2000 or 2001.
Yeah.
Yeah.
Well, then one of my questions to you, this is appropriate now, is what kind of training and what kind of certifications do you go through to be a certified nurse midwife?
So there is a master's degree program for most of the folks my age. It was a master's degree program. Now they've bumped it up a few credit hours to make it into a doctorate.
Oh, wow.
For a lot of the nurse midwives graduating today, they come out with a doctorate of nurse midwifery. And then there's some programs that you don't have to be a nurse first. There's, I don't know, maybe 3 of them in the country now, where you can go get your master's or doctorate of midwifery,
Yeah.
where you have to, you don't have to do the pediatrics and as much mental health and geriatrics as, I had to do as a nurse.
Mhm.
But you still get this pharmacy, pharmacological stuff, and most of it's focused on hospital midwifery. we got very little training in out of hospital nurse midwifery. I learned that basically from a couple of home birth midwives in the area. And then when we decided that we needed to open our birth center, they actually closed the OB unit for the little hospital in our county. And so we
Oh,
decided we had been going to open a birth center. We'd been working towards opening one in Roanoke, which was a bigger city. But then when they closed the little hospital out where I lived, and a couple of our board members were also lived in Franklin County, we just said, okay, let's just see about, open a smaller one in Rocky Mount. So that's what we ended up doing.
that's really neat.
And in Virginia, I don't know how it is in other states, but in Virginia at that time, I had to have a physician supervisor. And then now the law has changed over the years so that once you have had so many hours of practice under either another nurse midwife or a physician, you can practice independently. So currently I'm able to practice independently and just, refer and collaborate with physicians when I need to.
Yeah.
And I actually hired a certified professional midwife, that's done all home births and out of hospital birth. And
Yeah.
she had worked with getting the program in Florida set up to train CPM. So I had her come and watch me do deliveries here in the birth center because it is out of hospital, very home-like setting. And there were several things where she would stop me and say, now you can't do this. This is negative energy. I know y'all did it at the hospital, but you can't talk about how bad your weekend was or think at the birth. You have to have positive
Keep
energy.
it positive, and that makes sense, having given birth a few times, that makes so much sense.
So there was things like that were a little bit of an adjustment for me coming out of that hospital environment to just try and get the positive. And then the other type of midwife that's legal here in Virginia now is called a certified professional midwife,
Yeah.
and most of them have trained through apprenticeship with another certified professional midwife, or sometimes they'll find a nurse midwife that's out of hospital to train with. A couple of the ones in our area actually went to a school. I think one of them went to school in Texas, and there's a certified professional midwife school, I want to say in Maine,
I think
somewhere near.
there is. I think I've heard, and the one in Tennessee, of course,
Yeah,
the farm.
the farm. Yes, yes.
Yep. A lot
So
of people know about the
a
farm.
lot of people know about the farm and have visited the farm, but
Yeah.
and so in Virginia, the difference was for our actual practice up until this year, nurse midwives could prescribe medications for hemorrhage and the like the vitamin K that the state requires us to give. The CPMs were in the position of the state required them to give the vitamin K, but it did not allow them to give the vitamin K. They couldn't prescribe it. So up until and finally this year, they got it through the state legislature that the CPMs can carry oxygen and they can bring
Yeah.
the patients to stop postpartum bleeding and things like that. That just is common sense.
That's interesting. I birthed in Pennsylvania and I used a certified professional midwife, and she carried the oxygen and she carried everything. If there was ever an issue, she was prepared to deal with it. And when I had a problem, she dealt with it. And at one point, she took me to a doctor when I had had a miscarriage. But the vitamin K was always optional, and I chose not to do it. Is can a parent bow out of that when they give birth?
Yeah, in any time, even in the hospital, if a parent doesn't want that, even though it's state law for hospitals to give it, the parent
Mhm.
can decline
Okay.
it.
But
Yeah.
you have to, by law, offer it.
Yes.
Okay. All right. I just wanted to clear that up. It was an option in Pennsylvania. Now, in my experience, I had both hospital births and home births, and the home births were just absolutely amazing. Um, I went to a hospital first, not knowing any different, and then also when I did have a problem, I went to the hospital for a birth. So, um, but in that, you touched on something about pain management. You mentioned the epidurals, and in the hospital that a third of the women didn't use any pain methods other than whatever they did themselves. So let's talk about that. What about pain management during childbirth?
So most of our pain management outside of the hospital is with um, utilizing positioning and movement and just providing comfort measures. In
Yeah.
other words, if you're sweating, we have a cold washcloth to wipe your head, or
Yeah.
um,
Or a massage and the small.
heating pads, and um, just using different techniques to help get people through that labor. The
Yeah.
tub is probably we call the tub our epidural. So we always tell people,
Mhm.
wait, they can't take it any longer, and then get in the tub. And
Oh, that
a lot
made.
of people, that helps tremendously. The shower, people labor in the shower, and then we encourage people to eat and drink when they labor, because
Yes.
that's a big 2-pound muscle in there. And I tell people it's like sending somebody out to dig a ditch all day and telling them all they can have is ice chips or water, uh,
Yeah.
you know, a Coke or something.
Yeah.
It's basically what we had at the hospital. They could have clear liquids, but they couldn't eat. And I saw a number of times when I think that's what slowed people's labor down, was they ran out of energy because they wouldn't allow them to eat. And I think
Yeah.
the thing that really made me understand that is when I was a student nurse midwife, and we had a patient. We were trying to get her in labor. She'd been laboring all night, and I don't know, it was probably about 10 o'clock in the morning. My preceptor and I walked in, and she looked at us and she said, "If you would just let me eat, I could have this baby." And so I looked at my preceptor and she said, "Sure." She looked at the husband and she said, "You go get her whatever she wants to eat." She told the nurse to stop the medication, let her get up and get a shower, and we'd be back in a couple hours and we could restart the medicine. And so she ate a Whopper and a shake and fries, and then and took a shower. And when we started the medicine back, we were able to start it at half the rate, and she had a baby like in 3 hours. I mean, it was just like things just took right off.
It's amazing how when you allow the body to work the way it's designed, it almost always comes out
Mhm.
right.
Yep. Yep.
Yeah, and I understand the reasoning in the hospital setting. I understand why they won't allow a woman to eat, but
Hmm.
I don't think that it's right.
Right. Yeah. Well,
Right.
it just, to me, um, it's one thing if you have an epidural, because once you start down that road of narcotics and
Yeah.
epidurals, you are more likely to have a C-section. I mean, you're
Yes.
just increasing your risk. And so for them to not allow them to eat, I can understand that. But if we can keep people from getting to that point that they need an epidural, and one of the ways to do that is to let them eat, then
Yes.
makes more sense. So,
Yeah, it does make sense. But that is a really clear example of hospital interventions. And one of the big differences between a hospital setting and home or a birthing center.
right.
Um, I, having done both, and then also been with my daughters through all of their births so
Mhm.
far, um, one at home and one in a essentially a birthing center. Just the freedom to be able to move, to get in the shower or the tub when you feel like you need to have a drink of milk or juice or something for energy. And I remember with one of mine also, things were moving along slowly. It was a fine spring day, and I took the castor oil,
Mhm.
and within I think 2 hours. boom, he was there.
Wow.
Yeah, that really got things moving. Not everybody wants to do that. It cleans you out everywhere, but um, no, the setting in the hospital, I think it has generally improved.
Oh,
I
yes.
Yeah, I was with a young mom friend 2 years ago for the birth of her daughter in the hospital. I acted as her doula, and I was surprised. They allowed the room to be darker. The curtains were drawn. They were not constantly poking and prodding, and
Mhm.
they allowed her just kind of relax. And I talked her through contractions and rubbed her back and her feet and all of that. And she had a much better birth than the one previous to that. But it's such a stark contrast generally between hospital and birthing center or home. My hospital births were not fun. And as a matter of fact, I remember with the last one, um, I had refused the vitamin K shot and the vitamin K shot. And the head nurse in the maternity ward was not happy with me. And she let me know it. And one of the ways she let me know it was at 3 o'clock in the morning. She came marching into the room and she turned on all the bright fluorescent lights, huffing and puffing, kind of throwing stuff around, being angry, and walked out the door, leaving the lights on. Anyway, that's not the environment that is conducive to birthing or starting a child out. But I was looking for some facts and figures earlier about to contrast home birth versus hospital births and how they're managed. And honestly, I was dumbfounded by one of these that I found, which was from the where is it? I'm in the wrong spot. Okay. The American Journal of Obstetrics and Gynecology. They did a study. They looked at births between 1950 and 2009. They wanted to see what the differences and outcomes were. They open with this: planned home births were associated with fewer maternal interventions, including epidural analgesia, electronic fetal heart rate monitoring, episiotomy, and operative delivery. These women were less likely to experience lacerations, hemorrhage, and infections. Neonatal outcomes of planned home births revealed less frequent prematurity, low birth weight, and assisted newborn ventilation. Although planned home and hospital births exhibited similar perinatal mortality rates, planned home births were associated with significantly elevated neonatal mortality. Wait, you've just gone through this long list of all of these massive improvements between home birth and hospital birth, and you're going to close with less medical intervention during planned home birth is associated with a tripling of the neonatal mortality rate. Give me a break. And I bring that up just to point out that we need to be very well informed.
Mhm.
And it's difficult. When you read stuff like that, one thing that we need to remember is that the medical establishment is not pro home birth. They are not pro certified professional or certified nurse midwifery. They want women in the hospital. And so they can look at results like that and still come to the conclusion, which is not supported by their data, by the way. I looked through it. I cannot find anywhere where there is an increase in fetal mortality. As a matter of fact, other studies I've looked at over the years show a vastly decreased infant mortality rate with home births. I know that you've looked at that kind of those kinds of statistics, and I'm wondering what your thoughts are.
Well, I think as long as people are practical about what they are doing, I mean, just like, there are people that are not good out of hospital candidates. Their
Mhm.
babies are more likely to have a problem. For instance, if somebody is insulin dependent diabetic, or they have high blood pressure before they get pregnant, things like that, that are going to predispose your baby to having more problems.
Yeah.
You probably do need to be in a hospital. Or like I've had patients that I had one that she had heavy, heavy hemorrhage after every birth, and she knew that she would. She knew they always had to give her every medication they had in order to, and she'd still lose a lot of blood. And so, those are patients that those women need to be in the hospital. We still
Yeah.
weren't happy with her treatment in the hospital, you know,
Yeah.
because they the it was one of those things where she was having a good sized baby, and she started to get lots and lots of swelling at 39 weeks. Her legs looked like trees. I mean, just she was
Wow.
miserable. And I said, if you want to deliver in the hospital, let me go ahead and transfer you over. Let the doctors go ahead and induce you, because, this is just getting to the point of misery where your legs are, and the swelling is so bad. And so anyway, transferred her over, and they said, "Oh, we think she should wait another week. She's not 41 weeks yet." And so they made her wait to 41 weeks, and then they finally decided to induce her. And the whole um, time I was with her, for a lot of the time, every doctor that would come in would go, "This is going to be a big baby. This is going to be a big baby." And she was like, "I know. I've been telling y'all that for 2 weeks." And every nurse that would come in, I think we went through 3 shifts of nurses, she would say, "Now look, I bleed really bad when I have this baby. You need to have all these medicines in the room. They just need to be here." And they did not go get the medicine until after she started bleeding. They wouldn't check it out of the pharmacy box until she actually started bleeding. And I mean, here's a mother.
Oh,
Most mothers can tell you, if they've got a health problem and what you need to do to fix it or to help
or
them.
to help, yeah.
And it was like, no, they didn't bother to listen to her. And I just felt so bad
No.
for her. Um, and I can't do anything because I don't have any hospital privileges. Otherwise, I would have had her go on in and let's get this done. Uh,
Yeah.
but the difference, I think, for people that don't know the difference between obstetricians and nurse midwives, I think, is that obstetricians are trained more as surgeons.
Mm.
So they do wonderful repairs. If I have somebody that had a really bad tear, after the baby's born and we've gotten through that golden hour of breastfeeding and stuff, then we can go on in and let the obstetrician do that repair. Most of the repairs I can, do, but once they're back there through some of those rectal muscles or anything like that, you
Oh,
just want
yeah.
you want somebody that does this all the time, that's really good at it, and that's trained. If you need a C-section, they are wonderful surgeons.
Sometimes that is needed. Yeah.
And so that's why I say that's their specialty. That's what they're comfortable with. I have not met any physician that has actually sat through a labor of a woman who is going through a non-medicated labor. I don't think they know what it looks like because that's not how they're trained. Um, I actually had a physician one time. I mean, the woman is clearly pushing. You can hear the sounds of pushing that women make when they're pushing. And,
Yeah.
and this physician was sitting outside the door. We had called her to wake her up, but she, in her sleepiness, didn't know why she woke up. And she came and sat at the desk, and she could hear the noise in the room of this woman pushing her baby out. And she ran in the door and said, "What's going on here?" It's like, it just, it just didn't occur to her that, oh, I should be in there and catch that baby. And that was my, I just realized they don't see a normal birth, a normal labor, and the whole process. And
Yeah.
because everybody they see that they're delivering with an epidural usually, or like there's somebody that just comes in the door and delivers so fast they don't have time to get them an epidural. And so
Yeah.
that's those things that, yeah, that's their skill. And so if you need somebody that can do a surgical procedure, that's what you want. But
And there are,
don't need
I I think there are far too many cesarean births, and I have often wondered if it isn't a matter of convenience for the doctor,
yes.
and I'm sure it is at times. But then, I put this slide up, just as an example. Is this the kind of picture that we want our newborn babies to see as soon as they come out of the womb? These
Oh,
bright
that's so true.
lights and people in masks and all of that. It just doesn't seem quite right. But here's a birthing center in a hospital, and that's much more calm and homey like. And I'd much rather do that. And it allows the mother to be more relaxed, and then for the body to work properly.
Uh-huh.
But then again, to be at home in your own environment and not pushed and surrounded by the people that you want there, who love you the most, who you are the most comfortable with, who can help you to then deliver that beautiful baby. This is one of my grandchildren, to
Aw,
help you deliver and have a safe and calm and healthy delivery. Isn't that just a far better option? Um, I'm just appalled at the frequency of interventions,
mhm.
but they don't happen so much at home unless they're necessary.
Right, right. You're exactly right there. Because we don't start IVs on people unless they actually need one.
Mhm.
For instance, if you're somebody that's been throwing up your whole labor, then sometimes being dehydrated slows things down. So
Yeah.
we'll offer to give people an IV and get them caught back up on their fluids. But it's not something you have constantly hanging there. We give you the fluids and then we disconnect you. Um,
Yeah. So
it's
you don't have
so
to be attached to
there.
that.
Yeah. And the thing is, a lot of the hospital birth centers, because that's what they call our hospital labor and delivery now, the birth center,
Hmm.
or the birthplace or something like that. It looks pretty, but it's still got all the medical, equipment. They still want people on the electronic fetal monitor. And um, it just is rare that you get a nurse that is comfortable with just intermittent monitoring. They didn't even have a Doppler. I
Oh,
was with a patient at a hospital, going to doula her through her birth, and I had her in the shower, and I wanted to know what the baby's heart rate was because she was a
mhm.
little bit high risk. They didn't have a way to a Doppler that they could even bring into the shower, so that we could get the baby's heart rate. They just didn't get the heart rate because she was in
Oh,
the shower.
oh,
And
wow.
thinking, well, we're in the hospital because this is a higher risk labor. You would think that they would be wanting to get the baby's heart rate.
Wow. Yeah, I remember my midwife always had that little thing that she could.
We'd have some way to monitor that baby. And if people
Yeah.
don't want a Doppler, they do. There are ways to monitor the baby's heart rate a little bit with one of the special stethoscopes for that. Or
Yeah, yeah, I remember Kendra using that. Um, it's so vastly different. I'll say something for the hot water in the bathtub. The way I always described it when the pain during transition, it gets so intense. I remember lowering myself into the water, and it felt like a knife cutting through butter. So as my tummy was lowered in, the pain just melted away. Not that there wasn't discomfort and pain, but the intensity just melted away. And that's such a better option than an epidural, which is going to interrupt your body's natural, well,
yeah,
ability to feel what's happening for one thing. And then you increase the probability of a cesarean section because the mother, the, yeah.
well, I've had it's not uncommon when people have an epidural for their blood pressure to drop. And so I've had and that was back in my days as a nurse. that was one of the things I saw that I thought, gosh, we need to figure out a way to do this better, because I saw a couple of labors where everything was going great, no problems at all. Lady got her epidural, had good relief from it, but then we started getting drops in the baby's heart rate. And
Mhm.
because her blood pressure dropped. Well, even though they got her blood pressure back up to normal, the baby's heart rate never straightened out. And so
Wow.
it was one, so then they go for C-section because the baby's having these drops in its heart rate. And it was directly related to the epidural. Twice I saw that. And
Yeah.
so, but I don't always see people consented for that as to, how it can happen. And then
Oh.
since then, we've had a couple people we've transferred over to the hospital specifically to get an epidural. They had a long labor, things weren't progressing. We did everything we could, and they just needed to rest and get some relief so that they could, go on and labor some more. And so I was with one of them, and I had laid down on the couch to sleep because it had been a long labor, because the anesthesia was coming and he put her epidural in. And so I thought, well, I'll take a break while she's sleeping. I'll sleep a little bit. And then I woke up hearing the word C-section, and I jumped up and ran over to the bed and go, what's going on? Well, she's got these little dips in the baby's heart rate. And so I looked over at her blood pressure and I said, well, that's not her normal blood pressure. She usually runs, 20 points above that. And so the doctor and the nurse looked at each other, and the nurse goes, I'll give her another liter of fluid. And so they did. And her blood pressure came up and everything straightened out. And a couple hours later, we had a vaginal birth. And
Oh, that's good.
within a couple weeks of that, I had another patient go that I couldn't go with. That they only allowed 2 people in, and she wanted her partner and her friend to go with her. And so this same thing happened, but she didn't have somebody there that knew that that was a common side effect. And so everybody said, "Oh, I think you need a C-section. Your baby's heart rate is dropped
Oh.
now." And I found that out when she came for her postpartum visit, and we were reviewing it, and she told me, oh, this is what happened. And I was like, okay, now I understand. If I'm not there or somebody doesn't know that this can happen, then that's one of the reasons people have C-sections, is because I guess when they see the opportunity, it's 1 a.m. and they see the opportunity, we could get this over quickly, and I could.
Oh, yeah.
It's the
That's
only thing
so
I can
sad.
figure out why you wouldn't help somebody's blood pressure just get back up to where it's supposed
Did
to.
you tell that mother? Did you give her that
Yes,
information? Oh.
yes, she was already feeling guilty, just like it really didn't go the way I wanted it to. And so we talked a little
Yeah,
bit about that. And I told her, as a result of that, we've started adding that piece to our childbirth classes now, that
good.
if you go and if you have an epidural, this is a common side effect. And I usually tell everybody, know what your normal blood pressure is. I give them, a little card with their blood pressure on it for each prenatal visit, so they know what their normal blood pressure is. In case somebody's not there with them that knows, the husband or their mom or whoever, who can whip it out and go, oh, that's not her normal blood pressure, and help.
Yeah.
It's sad that I have to teach people the medical end of it, but if you're going to be in a medical environment, you've got to kind of know how to protect yourself.
Well, and there are 2 points about that I just want to briefly mention. Of course, be prepared, but one thing is most of our viewers have had hospital births. Few
Right.
of them probably have had or maybe will have home births, but for those who are thinking about it, just listen to this. This is really important. Um, you need to know these things and be prepared. Um, I strongly believe that a home environment is
Mhm,
generally safer,
mhm,
with a good midwife.
mhm.
I knew of a midwife up in Pennsylvania who was not a good midwife. She was loved amongst the plain community, but I knew personally several people she had harmed. 3. to be exact, and heard stories. And I recommended others to
Mhm.
those who I knew. Um, it's unusual to have a midwife, a professional midwife even, who isn't really good at what she's doing. Um, and definitely in one of those cases, she should have been like you and she should have transported, and she did not. In one instance, she used forceps,
Oh gosh, outside of the hospital.
and that child is paralyzed from the neck down for his entire life. Was
Mm,
perfectly normal until then. But in another case, just going into the training aspect of it, a friend had a 8 or 12 hour hard labor,
mm,
past transition, hard labor. And this same midwife had someone with her as a helper that was she was training. And that helper was taking additional training through other modalities that my own midwife had. And so she understood birth manipulation of the mom's body and the spine and different positions more so than this midwife did.
mm.
And the midwife wasn't listening to her aide because I
Yeah,
guess she
she's
was,
training her.
yeah, exactly. Matter of pride. Finally, after this lengthy, lengthy time with no progression and the mom being in hard labor and absolutely exhausted, as you can imagine, she finally allowed her helper, the person she was training, to manipulate the mom's body, and the baby was born immediately.
Yes, we find
So,
that with, the spinning babies exercises. I don't know.
mhm,
We
yeah,
we have added those to our labor. Um, if somebody stalls or things don't, the baby's not coming down, we've added doing those spinning baby things during labors, and our transfer rates have really gone down because
yeah,
it seems,
good.
yeah, I mean, it was amazing the difference when we started adding those and just trying to get people to go through those routine maneuvers. Um, and and it just knocks the baby loose or helps it get
Yeah,
nutrition, and it'll come down. So
yeah,
that was it's so true about that. Well, and the other thing that surprised me coming out of the hospital into the home and or the home and the out of hospital environment was the difference it makes for dads. I was shocked at the way that it bonds the couple together that you don't
yeah,
see in the hospital
right.
because the woman and the man work together and just get this baby out, and they depend on each other. And so often, that partner knows the woman better than we do and knows what she wants,
Just like this group here, yeah,
and that person is the person that makes her feel safe. And
yeah,
that's usually what I tell people is you want people around you who are positive, who make you feel safe, and the place that you labor in should make you feel safe. If you
yeah,
don't feel safe at home or in the birth center, you probably won't do as well as you would in the hospital. But if you feel safer at home, you will probably do better in the home than you will in the birth center. If you feel safer in the birth center, you'll probably do better in the birth center. So you kind of got to look inside and feel, see what makes you feel safe, and who's going to bring the positive energy to the situation. If your mom and your partner don't get along and they're bickering all the time, that's not the people to have at your labor. You want somebody that's not going to be um, at each other's throats, and you're having to
yeah,
be the go between, and that's rare. Most of the time, people will get along during the labor, but we had one whose mother was a midwife, I think in Africa, and
oh.
we had to kick her out because she was bringing so much negative energy to the birth. The birth mom finally just said, "Mom, you've got to take a walk or something," and because
Oh, wow.
he was just making her so anxious. And so, yeah, and that's really rare. Most of the time, family members just kind of come together and help and rub backs, and help
Yeah.
hold and just get the mother what she needs, and so we see it as a really great bonding for families, that I never saw in the hospital. That love hormone that
Yeah.
you have when you labor, goes towards your partner rather than the doctor or the nurses.
Yeah.
Um,
And you can deliver your baby, hold your baby, and then it's not immediately taken away to
yes.
be weighed and measured and poked and prodded in
Yeah.
an in
Yep.
yeah, it's just totally different. I strongly prefer this
Mm-hmm.
to, oh, what's the other option? To this. It's just it makes you feel tense. It's so unnatural. But again, I don't want anyone who is comfortable in a hospital setting or who has given birth in a hospital setting, we don't want to make you feel bad at all. Um, what your experience is, it's in the past. You can't change that. And maybe you just want to think about what you can do differently, um, going forward, even if you do go into a hospital setting, if that's your choice, or if, like you, the other point that I really wanted to make is that when you have a good midwife, when it's necessary, that midwife, like
Mm-hmm.
mine did, will send you to the hospital. I
Yeah.
needed to go to the hospital with one of them.
But we
You
don't
know,
want a mom or a baby to have a problem if we can help it. I mean, that's just, if there was something we can do in the hospital to help somebody, then we don't want to keep you at the birth center. So
right.
that definitely is, and you should really talk to people that have used a midwife before if you're thinking about doing it. Um, you know, and depending on where you are, it can be a wide variation of what's available. I mean, I had
Oh, yeah.
a niece that had a water birth in a hospital. So they had birth rooms with water birth availability and, monitors that would go in the water if somebody needed to be monitored. And other hospitals just don't have that. And some have midwives. Some midwives work more like physicians, and cut episiotomies more often, or,
Yeah.
more used to, doing things like that. And other midwives are very hands off.
Yeah. Actually, one of my daughters had a midwife who was, we felt too hands off,
Yes.
but it, she had a safe delivery of a healthy baby, but she would have actually liked her to be a little bit more hands on. I thought my midwife was perfect.
Well,
She really was. And she became a good friend. And, she would spend 2 days with me.
yeah, well, everybody's idea of what a midwife is different, and I had to kind of come to terms with that because some midwives don't view their role as doing massage and helping with positioning. That's the assistant or a doula or somebody else's role. They're just there in case something goes wrong. And so depending on where people are from and where they were trained, it could be a big difference in what you get from your midwife, just like it
Yeah.
is from your physician. So, I mean, because some physicians are just so great to work with and, let you have all the
Mhm.
time you want with your baby and that kind of thing. And then others aren't. So you really do have to kind of pick and choose and
Yeah.
get references and check with people's backgrounds and that kind of stuff when you're choosing a midwife.
And to that end, I was going to ask if you had suggestions about what women can be looking for if they want to choose a birth with a midwife, and if they want to choose a home birth or a hospital birth.
Mhm.
What are some things that they can do, or questions that they can ask?
So I find it easier to you can ask the hospitals, like our main hospital will say, "Oh yeah, we have tubs, we have." They'll tell you all the things they have, but you need to actually talk to somebody that's used that hospital and did they let you use the tub? Did they let you, was your nurse, are the nurses really good with if you want a non-medicated birth, because there are
Yeah.
some wonderful nurses that we've encountered in the hospital that knew all the spinning babies exercises, knew extra ones that they could do when people had epidurals that really worked with us. And then we had others that they really didn't have that much interest in that kind of thing. And they were very happy if you had your epidural and they could sit at the nurse's desk and
Yeah.
your strip. And so,
Mhm.
just it, so it's one of those things where I would just talk to people that are there and that have been there, had their babies, and see what their experience has been as far as being able to do your own thing. Because as long as you want to do what the hospital wants you to do and follow their path of what they do, you'll be fine.
Mhm.
You won't find anybody that is not upset with you. But if you're
Yeah.
somebody who wants to do something a little different, like you want to delay the cord clamping for 5 minutes,
Yes.
or to
That's a big thing. That's a
it's a big thing for some doctors just really don't go for that. And
yeah.
if it's a group of midwives or a group of physicians, can you stick with one or two of them, or are all of them in the call? For instance, we have a physician group that a lot of people like. There was two or three physicians, but they were in call with two other groups of physicians so that they didn't have to take call but a couple times a month or 3 times, whatever it is. So you still ended up getting somebody you didn't know when you were in labor. I've seen it that way with big midwife groups at some of these hospitals. You just get ever who's on call. You want to look at the size of the group of midwives and how they do their call schedules, you know, and and things like if you're doing out of hospital birth and you've paid all your money, and
Yeah.
at the end your blood pressure goes up and you have to be transferred to the hospital for delivery, will you get your money back for the labor and delivery and newborn services that the hospital does instead of because there are some midwives, once you pay that fee, they keep the whole amount of money even though they don't provide the service.
That is something too that I've encountered, not personally, but other people, and I've thought, "Oh, we're usually paying totally out of pocket for these
Yes,
services,"
yeah.
and I would expect for the midwife who has attended to me before and after to certainly be paid, but, um
Yeah, but if I've got to pay a big hospital bill, I shouldn't also have to pay for the birth center if I never even use the birth center.
Right, right.
And then the other thing is, like, what do they need you to get for your birth? Because what do you
Yeah,
have at the house? Because you really want a list of all that stuff. Some
yep.
midwives require that you have food for the midwives and their assistants, and they'll give you a list
That's
of food to have on
that's
hand.
interesting. I always just had it, but I know that my midwife and the midwife, one of my daughters has had a couple, and they've carried their lunches with them. But just as we're wrapping up, I'll just relay one of the most beautiful images that sticks in my head, besides the times that my midwife walked with me and talked with me and calmed me, was at one of the grandchildren's birth. She had an Amish midwife training another Amish midwife, and that Amish woman was so kind and soft spoken and gentle. And as my daughter was resting, leading up to transition, um, the midwife did everything she could to make her comfortable. There were candles lit. It was just a very calm setting. And she gently closed the door and left my daughter and her husband, just him there supporting her.
Yes.
That midwife laid on the floor outside their bedroom door, and she stayed right there, head against the door so she could hear, but she was there
Mhm.
trying to get her own rest also, but very much aware. It's just such a beautiful picture
Oh,
because she really genuinely cared.
right.
And even through a period of rest, she was right there, as I think a good midwife would be. And I imagine you are too. Um, I'm going to wrap it up now. I actually have one of my daughters who's due to have a baby soon walking up with her daughter and a couple of neighbor kids. Um, but we're going to learn a lot more from you, Karen, and be able to answer a lot of questions and dig deeper in another, well, a week from Friday, on the 19th and 20th of April at Melvin's Farm to Fork. We are going to have a breakout session each day with Karen and also with Megan's Sanctuary to talk about nutrition as well. But we're going to learn more about how to have a healthy, safe delivery of a healthy baby. And we'll be able to ask and answer lots of questions of Karen and of others who have gone through these experiences, people like myself. Um, it's neat when we've actually been able to see multiple sides, and you especially from your viewpoint as a professional. It's really refreshing to hear your take, and I'm just eager to learn more. Even though I'm past my childbearing years, I'm watching my daughters and daughters-in-law, and I'm really just enjoying watching their journey and being able to be part of it. But we'll be able to learn so much more from you. And Karen, I'm so very grateful to you.
Well,
So thank
thank you
you.
for having me, and I'm looking forward to the conference next week.
Thank you. I am too. It's going to be fabulous. I'm just super excited. We all are. So, everyone, thank you for tuning in. And hopefully, we'll see a bunch of you at Melvin's Farm to Fork. The link is in the show notes. So, you can still sign up to register to attend. We hope we see you there. Bye bye, everyone.